A warm good morning to everyone. I am Malathi, Assistant Professor in ES College of Nursing. Today we have to see about the topic of nephrotic syndrome in children. What is meant by nephrotic syndrome? The nephrotic syndrome, we have to move on to the nephrotic syndrome. The nephrotic syndrome is a group of symptoms which is seen in any condition that seriously damage of glomerular capillary membrane, causing the increased glomerular permeability with loss of protein in the urine. It is nothing but, before going to move on to the definition, I have to give an example of nephrotic syndrome. We have prepared the two glass of apple juice. In the bottle, one is clear, no patches present. The juice is very clear in this glass. That is comes under by the normal kidney. It does not have to produced by the protein in the urine. That is the normal kidney. It is not produced by the protein in the urine. In another one glass of apple juice, in this apple juice may have to present by the some of the patches or peels of apple skin in this have to present in this bottle. That is some of the protein has present in the urine is have to comes under by this called as nephrotic syndrome. That it is one bottle is contains the clear apple juice and another bottle is as seen in this some of the patches, some of the sedimentation has present in this apple juice. In this clear bottle is comes under by the normal kidney. There is no protein in this urine. In this, another bottle of apple juice has present in the some of the patches, that is has you have to mention by the some of the protein in the urine, you have to called by the nephrotic syndrome. Okay, next you have to move on to the definition. In the definition, the nephrotic syndrome is a group of symptoms characterized by proteinuria as a greater than 3.5 grams per day have to lost by the protein by the urine, or otherwise you have to comes under by the low blood protein level and high cholesterol level and edema may have to cause. After that you have to losing the protein in the urine more than the 3.5 gram per day, in increased protein in the blood and plasma protein, and I have to especially by the albumin also has to lost. The increased oncotic pressure may have to develop by the nephrotic syndrome, or otherwise you have to comes under by the hyperproteinuria, the hypoproteinuria, edema and hyperlipidemia, increased risk of thrombosis, increased gut and hypertension. The baby have developed by the lethargic, fatigue and unresponsive and depression is comes under by this what nephrotic syndrome. We have to see about the nephritic syndrome and nephrotic syndrome. The differences between the nephritic and nephrotic syndrome in the sense, the nephritic syndrome in the sense have to increased blood flow by the capillary refilling time and inflammation of the glomeruli. The glomeruli has to inflamed, has caused by the oliguria and have to comes under by the hematuria, that is cola colored urine has to present and have to Burger disease, that is IgA nephropathy may have to develop by the baby, is the most common cause of primary glomerular nephritis. That is comes under by the nephritic syndrome. The nephritic syndrome is nothing but increased hypertension and inflammation of the glomerular nephritis may caused by the oliguria, the oliguria caused by the hematuria, and the hematuria has comes under by the IgA nephropathy. This is the main cause of nephrotic syndromes. The nephritic syndrome in the sense may have to develop by the hypoalbuminemia and hypolipidemia may caused by the massive proteinuria. They have to spilled with the protein, mixed with the protein in the urine may have to lost by the proteins and have to comes under by the peripheral edema may have to caused by the side. That is comes under by the nephrotic syndrome. The next move on to the causes of nephrotic syndrome has comes under by the autoimmune disease such as systemic lupus erythematosus. The autoimmune disease is nothing but you have to antigen antibody reaction has have to formulated by the against the body system may have to develop by the may have to affected by the glomeruli or have to comes under by the nephritis. It is an autoimmune disease such as systemic lupus erythematosus. The baby have developed by the yearly diabetes mellitus, or otherwise have to increased hypertension, yearly hypertension, a drug toxicity, excessive use of NSAID drug, and malaria, hepatitis infection may has to caused by the nephrotic syndrome. If your child shows the easy fatigability, slow growth, swelling around the eyes or elsewhere of the body, and shortness of breath, consistence of weight over the ear, and red and black urine color in the sense may caused by the nephrotic syndrome. The type of nephrotic syndrome in the sense primary or idiopathic nephrotic syndrome, secondary nephrotic syndrome, and have to serious and rare congenital nephrotic syndrome. The primary and idiopathic nephrotic syndrome have to seen by the 90% of children. In the secondary nephrotic syndrome have seen by the 10% of cases, and serious and rare condition nephrotic syndrome have to seen by the 5 to 3% of cases. The primary idiopathic and nephrotic syndrome is most common in the children. Exact causes unknown, but are mainly associated with the autoimmune cause. The autoimmune cause, already I said, antigen antibody reaction is abnormally has to taken place, may caused by the autoimmune cause. It is also known as minimal changes in the disease. This disorder result in abnormal kidney function, but when the kidney tissues is examined under the microscopy, it appear the normal and nearly normal. The disorder is result of abnormal kidney function. The abnormal kidney function is nothing but have to excessive produced by the protein, excessive produced by the albumin in the urinalysis comes under by the abnormal kidney function. We are otherwise have to not have to excreting of the fluid, the decreased urine output, that is also have comes under by the abnormal kidney function. The accumulation of fluid over the edema by the other of the bodies is comes under by the abnormal kidney function, but when the kidney tissues in the examined under the microscopy, it appear the normal or nearly normal, you have to assist. The secondary nephrotic syndrome, the causes may be various disorder that can damage the glomerular kidney. It is have to not stately affected by the nephrotic syndrome, have to other than the disease may have to damage by the glomeruli. In this disease such as diabetes mellitus, if the babies have to taking the diabetes mellitus or hypertension or systemic lupus erythematosus and other infection might be cause of may affected by the glomeruli, they have to affected by the kidney. This is comes under by the secondary nephrotic syndrome. The secondary nephrotic syndrome is nothing but they not affecting the state onwards of disease, have to affected by the secondary disease condition. The secondary disease condition in the sense primarily baby have to affected by the hypertension or diabetes mellitus or systemic lupus erythematosus, they may have to affected by the secondary nephrotic syndrome or affected by the glomeruli or kidney. Next, we have to move on to the congenital nephrotic syndrome. The congenital nephrotic syndrome, it is a serious and rare condition caused by the autosomal recessive disorder. It is a no therapies or effective. Usually, infants die under the 1 or 2 years of age. It is have occurred during the delivery. Have to baby in this womb itself, mother womb itself, the baby have to develop by the nephrotic syndrome. In this nephrotic syndrome, it is a rare condition. It is also have to autosomal recessive disorder. It is mainly have to not have to produce by the proper treatment. If the baby has go for the after 1 or 2 years, we have go for the die. They have to, some of the signs and symptoms have differ in the nephrotic and nephritic. The nephrotic syndrome has to comes under by the glomerular capillary refilling time or glomerular capillary filling time is have to assessed by the podocytes and effacement and albumin in the urine, and fourth urine and proteinuria may have to cause. If the baby have to develop by the periorbital edema or have to ankle edema have to occurred by the nephrotic syndrome, or other signs and symptoms have comes under by the hyperlipidemia or hypoalbuminemia has to may caused by the nephrotic. Versus nephritis in the sense mild edema has to present by the periorbital, and babies have mainly focusing on the hypertension and brown urine, that is comes under by the hematuria, and the hematuria RBC has present in the urine. In this nephrotic syndrome have to present in the protein in the urinous is comes under by the nephrotic. Nephritic in the sense brown urine hematuria, the RBC has to produce in this urinous is comes under by the nephritic. Okay, they have to bilaterally palpable and purpura, it is a cause of have to HCP. The main cause of nephritic, the post streptococcal infection or IgA nephropathy or have to comes under by the sickle cell anemia. The main next we have to move on to the pathophysiology of nephrotic syndrome. The pathophysiology in the sense damage of glomerular capillary membrane. In the first you have to occurred in the sense the glomerular membrane may have to damaged. First you have to damaged by the capillary by the glomeruli. After it has to go for the loss of plasma protein and albumin. Once you have to glomeruli has to affected. The glomeruli has to damaged in the sense. Next move on to the plasma. Loss of plasma by the protein in the albumin. Afterwards, it comes under by the simulated synthesis of lipoprotein and hypoalbuminemia. In the simulation synthesis of lipoprotein may caused by the hyperlipidemia. The hyperalbuminemia has caused by the decreased oncotic pressure and generalized edema. The generalized edema in the sense have to accumulation of fluid over the vesicular space or extracellular fluids. That is, it comes under periorbital edema or pitting edema may have to develop by the generalized edema all over the body. The activating the renin and angiotensin system and have to go for the sodium retention and edema has to produced by this nephrotic syndrome. The clinical manifestation of nephrotic syndrome, the baby has looking like a excessive weight gain, edema, periorbital initially, then the extrematous and increasing in the morning. The excessive weight gain, the edema may caused in which part in the sense periorbital edema have to occurred initial stage. Afterwards, extrematous also have to increased by the edematous. During that morning have to easily visible the edematous. After that, the baby have to develop by the ascites, scrotal swelling and labial swelling may be present. The urine changes in the sense have to present in the hematuria or otherwise have to comes under by the protein in the urine. The decreased volume and the urine has to decreased by the flow of urine. Have to comes under 10 ml, 20 ml, 50 ml of urine may have to caused by this each excretion. The frothy and pala skin have to develop. The edema of intestinal mucosa may lead to loss of appetite and poor intestinal absorption. Because of the protein has to excrete loss, the fluid has to accumulated by the body. The loss of appetite may have to develop by the baby. The fatigue, the baby have to looking like a fatigue, lethargic and irritability. Increased blood pressure may be normal or slightly decreased due to decreased intravascular volume. Susceptibility to infection and increases. The dyspnea may be seen due to the pleural effusion and ascites and other type of fluid. If in case of baby have to develop by the difficult to breathing in the sense baby have to becoming a weight gain or otherwise have to comes under by the pleural effusion. The baby have to develop by the ascites in the sense baby have to difficult to breathing, that is termed as called as dyspnea. Next we have to move on to the history collection. How you have to collect the history from the nephrotic syndrome babies in the sense you have to collect the family history. Previously any family members have affected by the nephrotic syndrome or otherwise you have to congenital or have to comes under by the primary or secondary you have to assessed by this family history. After that birth history, if the birth history in the sense if during the birth the baby have to develop by the normal birth or have to develop by the any other conditions like have the baby has comes under by the sepsis or any other growth retardation, the baby has to comes under by the low birth weight baby in the sense you have to develop by the some of the infection that is has caused by the birth history and antenatal history. During the antenatal history, mother have to develop by the any type of infection such as syphilis or mumps or rubella, may any toxic substance infection may or mother have to develop by the diabetes mellitus or hypertension in the sense may also baby have to develop by the nephrotic syndrome. Afterwards you have to collect by the history of physical examination. During that physical examination you have to collect the urine analysis history, that is you have to baby have voided by the urine by the blood in urine, that is hematuria or proteinuria have to, that is it comes under by the protein in the urine you have to assess by the mother or abnormally high level of nitrogen containing, that is acetomia, have to develop, and oliguria, low output of urine. You have to ask the mother how much of urine the baby has passed during that daytime. That is, you have to comes under by the oliguria, low output of urine you have to assess. Afterwards, you have to measure by the blood pressure. If the babies have to develop by the nephrotic syndrome, in the sense you have to develop by the hypertension, or baby have to develop by the blurred vision. Next, we move on to the diagnostic evaluation. In this, during the diagnostic evaluation, you have to mention by the urine analysis, shows marked proteinuria, cast and few RBCs, increased urine specific gravity, 24 hours urine protein excretion. In this 24 hours urine protein excretion, how much of protein in the urine? You have to greater than 50 mg per kg per day has present, in the sense that is comes under by the have to abnormal urine proteinuria have to develop. The hematology and normal or increased hemoglobin level, high platelet count you have to assess, kidney biopsy, KUB X-ray, USG investigations have to assess by this USG have to assess the kidney size and kidney functions, and serum markedly decreased serum protein and albumin, high cholesterol level by the baby have developed by the nephrotic syndrome, in the sense 450 to 1500 mg per dl, and hyponatremia I have to assess. Afterwards, the baby has developed by the nephrotic syndrome, in the sense main complication is blood clots, venous thrombosis may have to develop, poor nutritional status and high blood pressure, acute kidney failure may caused by the chronic kidney failure. The management is have to given by the some of the goals and management of mother by reducing the urinary protein excretion, reduce the fluid retention, prevention of infection and complication by the child. The medical management you have to provide by the diuretics. You have to you have to increase the urine output level, have to lose the edema status, that is as comes under tablet furosemide or injection furosemide have to administer, spironolactone, and corticosteroids is prednisolone has to give. The albumin infusion has helps to losing of albumin, you have to maintain and balancing the albumin, that's why you have to produce or administer by the albumin infusion. The immune suppressant therapy for child who continue to have a proteinuria plus 2 more or more. In this urine, the proteinuria is plus 2 or more, in the sense after 8 weeks, steroid therapy are treated with the immune suppressant therapy such as a cyclophosphamide has to administered by the particular child. The nursing management you have to maintain by, if in case of you have to receiving the nephrotic syndrome child, in the sense monitoring the edema and urinary catheterized, and you have to put the albumin status, and you have to maintain the IO chart and abdominal GERD chart if baby has to develop by the anytime ascites, so you have to mention the abdominal GERD chart, and daily weight, how much of weight they has to gain, that is have to develop by the edema or other ascites during the nephrotic syndrome patient, and administer the medication such as diuretics, antibiotic and corticosteroids as per the doctor's order. The nursing management is improve the nutritional status, low sodium diet, high calorie and high protein diet has to advise the mother, and small and frequent feeding has to administer by the child. The encouraging the activities and exercise, maintaining the skin integrity, provide the skin care, change the position every second hourly once, check for skin breakdown, and prevention and manage of side effect and steroid therapy, and discharge the plan and home care teaching by the child. The mainly have to comes under by the nephrotic syndrome. As per nursing intervention, you have to given by the some nursing diagnosis, impaired urinary elimination and imbalanced nutritional more than the body requirement, excessive fluid volume and activity intolerance of child, and knowledge deficit related to the disease condition, and fear and anxiety related to the disease as per the hospitalization of the child mother. Thank you.